Right now, cases of the norovirus are on the rise according to the CDC. So far, there have been 91 outbreaks reported nationwide. That's roughly 24 more outbreaks compared to the last week of November. And cases here in Colorado have gone way up over the past few years. There are a lot of questions about this disease.
Our 9 News health expert, Dr. Kohli, is joining us now to answer some more of our questions. Dr. Kohli, good morning.
Good morning.
Well, we're happy that you're back with us and feeling a lot better. Good news seems to be everywhere. How exactly does it start and how does it spread?
Yeah, it is everywhere. In fact, this year we've seen more cases than we've seen in previous years. So it's a virus that causes a gastrointestinal illness. And it's really, really robust. And you just need a few tiny particles of this virus to get it, which is why it's so contagious. And you can, of course, get it from food. So if somebody who has the virus prepares your food maybe without washing their hands when they go to the bathroom, you can get it from sharing utensils with someone who might have had the virus, but you can also get it from surface contact. So if for any reason there's a contaminated surface, especially in bathrooms, but even in areas like kitchens and restaurants, you touch the surface and then touch your face, you've inoculated the virus.
Is there any way to tell a difference between like food poisoning, like you just ate some bad meat or something like that, and this, or like the regular flu?
So there's a couple of ways to tell. So one, if you go to a hospital, you can actually get a stool test that looks for virus particles in your stool. That's not commonly done. So really what I would suggest is looking more at the symptoms when they started and when you may have been exposed. So if you think about food poisoning where you ingest a toxin, usually as soon as the toxin gets out of your body, whether it's with vomiting or diarrhea, the symptoms resolve. So they can usually resolve in about 12 to 24 hours. This, on the other hand, can last two to 3 days. So it starts about 1 to 2 days after you've been exposed, and then it can last 2 to 3 days. For most healthy people, for people that are immunocompromised or older people, it can actually last for several weeks. And you're shedding the virus in your stool for up to 2 weeks after, even after your symptoms get better. So it is really important for you to make sure, even after you feel better, that you take precautions.
What is it about this year, though? Why now are we seeing that rise in cases as opposed to the previous years?
Yeah, so the epidemiologists have been scratching their head, and there's sort of two reasons. One is an us reason, and the other is the virus reason. So the us reason is post-pandemic. During the pandemic, and last couple of years, we were really good about hand washing. And this virus, interestingly, doesn't get killed by sanitizer. It has to be washed with soap and water. And now I think we've sort of relaxed. We're washing our hands a little bit less. We're not quite as clean as we used to be immediately coming out of the pandemic. And of course, everybody traveling, gathering over the holidays. That's what's causing the outbreak. But the second reason, which we don't yet know, is has the virus changed? Has it become a more aggressive strain of the virus, perhaps more robust or more contagious or more easily spread?
What do you suggest if someone thinks they got it, not feeling so great, may have some of the symptoms? What should they do?
Yeah, so I would say at this point, just assume you have it. And this is a pretty bad virus, guys. So it's a really bad GI bug, like your sudden onset vomiting, severe diarrhea. The most important thing is to stay hydrated. I would say you don't need a test, definitely don't need antibiotics, and try to stay away from that Imodium, because that can actually make things worse because it prevents the virus from getting sort of expelled out of your body. So don't reach for that. If you assume that you have it, make sure you protect the others around you by using bleach on surfaces, not preparing or handling any food or medications for at least 3 days after your symptoms resolve to make sure you're not shedding. And it's really important to stay hydrated. If you're not able to stay hydrated, that's when you think about going to a doctor.
Well, just briefly, because you said symptoms don't start until 2 days or so after you contract that virus. How would you even guess that maybe you might have been exposed to it if nobody else told you or they didn't know they had it?
Yeah, it's kind of a tough one. And that's why I think it's really important for us to go back into our sort of pandemic mode of before we sit down to eat anything, whether it's on an airplane, whether it's at a restaurant, just quickly run to the sink and wash your hands.
Clean your space.
Yes, and make sure you're just being really careful. And then be mindful, given the outbreaks, of sharing utensils, sharing water, with people in a public setting and such. But yeah, the symptoms can come on 12 to 48 hours after. So you kind of have to dial back, call your friends, and ask if anyone else got sick. And again, number one cause of foodborne illness. So if you go to a restaurant, it's likely you could potentially get it from there. So
you were saying like regular sanitizer really doesn't kill it. Is there a specific type of bleach sanitizer that you can get to have in your household for surfaces and stuff like that that does work?
Yeah, so Clorox bleach will work. Any kind of bleach-based product will work to wipe surfaces. And on your hands, of course, that 20 seconds of hand washing, which was that happy birthday twice.
Yeah, exactly.
You got it, yeah. Lots of soap and water and kind of warm water in general. That's really, really important.
Our neighbors are about to smell lots of bleach in our house, just coming from the windows.
All right, Dr. Kohli, thank you so much. Appreciate it. Chris? Oh, you can find all of Dr. Kohli's appearances. It's been a while since I've been with you. We've been on vacation. You can find all of Dr. Kohli's appearances on our website, 9news.com/Dr. Kohli. Chris?